Okay, so today we're going to discuss about the hemoflagellates. So when speak about the hemoflagellates, so hemoflagellates is the words are flagellates. So these are a flagellated na parasite, but they are not infecting our gastrointestinal tract, but rather they are found in our peripheral bloodstream. So this topic will be discussing the genus Leishmania. That includes here the Leishmania brasiliense, Leishmania tropica, Leishmania donovani, and we have here the Trypanosoma, the genus Trypanosoma, which includes your Brucey, that's your Brucey gambiense, Brucey rhodesiense, and we have your Trypanosoma cruzi. Okay, now we have here the stages of the development of your hemoflagellates. We divided one into the first stage. So we have here the first stage. We have here a mastigot. Other name for that is your leishmanial. We describe the mastigot here as rounded. Okay, so it's an oval shape na intracellular. So this is intracellular, mean to say, for example, intracellular, this is the stage of the parasite where it enters most likely the RES or the reticuloendothelial system, including your macrophages, where they try to invade the different cells in our body, including also your phagocytic cells. So we have here the nucleus. The nucleus here found in the posterior side, and the nucleus would have here a large centrally located na karyosome. On the anterior side, what you see here would be the kinetoplast. The kinetoplast characterized here by, it's made up of the blepharoplast. Another one, we have here the parabasal body. And this would be characterized, this is the stage where there's no, there's an absence of the flagellum or flagella, and the absence of the undulating membrane. Okay, the next stage, we have here the promastygot, also called here the leptomonad. So notice here that it's being described as rounded posterior, and we have the tapered anterior side. So still again, the nucleus here found in the posterior side, and the kinetoplast still in the anterior side. Only that what you see here would be already have a flagella. But then wala pa din siyang undulating membrane. Okay, the third stage, we have here the epimastigot, also called here as your cretidial. So notice here that this would be the same structure found in the promastigot or your leptomonad stage. Only that, again, still your nucleus is still in the posterior side, and the kinetoplast is still in the anterior side. But then again, what you have here would be the addition of the undulating membrane. We try to extend towards the flagella. Kanina sa ating promastygot, wala pa itong undulating membrane. But here in this epimastygot, may flagella plus meron siyang undulating membrane. Okay, and for the last stage, we have here the trypomastygot, also called here trypanosomal. So still rounded posterior, tapered anterior, but only that ang pinagkaiba. So notice here that your nucleus is already on the anterior side, but on the previously na mga stages, they are here. Dito siya sa posterior side. But here, notice that your nucleus here is already in the anterior side. At dito na sa ating posterior side, makikita ang ating your kinetoplast. Plus, the flagella is still on the anterior side, and but the undulating membrane here is extending. Okay, the undulating membrane is occupying the entire body of your trypanosomal or your trypomasticon. Okay, another one, this characteristic of your trypomasticon, you could see here your sum will have the presence of the volutin granules. The volutin granules is usually seen on the chronic stage. Okay, and for the stages, so again, in the case of your Okay, in the case of your Leishmania, the stages that could only be found in Leishmania would be the first two stages. This includes your amastigot and the promastigot only. Wala siyang epimastigot and wala din siyang trypomastigot. In the case of your Trypanosoma brucei, that's your brucei gambiense and brucei rhodesiense, what you found here in the stages would be the last two. This includes only your epimastigot and your trypomastigot. Wala siyang first two stages, the mastigot, and wala din siyang promastigot. But in the case of your Trypanosoma cruzi, again, all the stages could be found. That includes your that includes your mastigot, promastigot, your epimastigot, and then your trypomastigot. Okay, for the vectors, again, the hemoflagellates are transmitted primarily by your arthropods. Those are mga blood-sucking insects. So, in the case of your trypanosoma, in the case of your leishmania is transmitted primarily by your sandfly belonging to your genus Phlebotomus and your Lotsomia. We'll be discussing that each one of that when we go naman sa each of the genus. But in the case of your Trypanosoma brucei, that's include brucei gambiense and rhodesiense, that one's transmitted by the cheche fly belonging to your genus Glossina. And in the case of your Trypanosoma cruzi, that is transmitted primarily by the bite of your Ridovid bug or your Triatoma bug. Okay, so we go to your okay, we have here your Leishmania. Okay, so we have here the life cycle of your Leishmania. So this includes here, this will be the same life cycle as with all your species of your Leishmania. Okay, so we start here with your vector. Again, the vector here would be your sandfly belonging to your genus, either Phlebotomus or your Losomia. Okay, so the sandfly in the proboscis of that contains here the promastigot. So you get infected by the promastigot coming from your um, in the saliva of your vector. So as this sandfly try to bite the human, it try to introduce the promastigot. Once the promastigot is in your skin, the promastigot here enter the RES or be taken up by your different phagocytic cells in our body. So within that one, pag pumasok na sila because they are being ingested here by your reticuloendothelial system, that includes here your macrophages and even your phagocytic cells. So within that cells, it try to multiply and the promastigot here it transformed to become a mastigot. And then the mastigot here, as it try to mature, it try to rupture the cell, including your macrophages and your phagocytic cells. Once it try to rupture, this mastigot will be released to your bloodstream. And from the bloodstream, that would eventually try to go here, different part of your body. So it depends pala. Okay, so in the case of your Leishmania tropica, this is your cutaneous. So ang mastigot natin will just be remaining on the skin. Kaya tinawag itong cutaneous leishmaniasis. In the case of your Leishmania brasiliensis, so from the skin, na-introduce siya, then that will try to migrate here to your lymph nodes, to your bloodstream, and eventually, from your skin, it try to migrate to your different mucous membranes, like especially in the nasopharyngeal area, your nose, your pharynx, and all of that one. And try to see this is your mucocutaneous leishmaniasis. In the case of your Leishmania donovani, this is your visceral leishmaniasis. From the bloodstream, your amasago here try to go to the different visceral organ or body or your hollow organs or body. Like mga internal organ natin in your abdominal tract where eventually try to infect on that. Making your Leishmania donovani as your visceral leishmaniasis. And then after that one, So from the infected patient, here comes the second, the vector, which is uninfected, not infected the vector. But once it try to take up a blood meal, it try to ingest the blood or try to bite the infected patient. Once it try to bite that one, it try to get the blood sample of that infected patient. What it gets here would be your mastigot. And then the mastigot inside the body where vector, the second vector here, would eventually try to migrate to the mid-gut or at the middle portion of the abdominal trunk of that, where eventually you try then to transform to become your promastigot. Then promastigot here try to migrate up to the proboscis or salivary gland, where eventually you could find the parasite on that area. And once it try to bite another patient, it try to introduce through its saliva. So the cycle goes on. So notice here that in the case of the leishmania, what you have here is only two stages. Ito lang promastigot. So promastigot is the infective stage to human. And a mastigot, on the other hand, is the infective stage to your vector. Okay, so in the PowerPoint, we have here the manifestation of your leishmaniasis. So we have your cutaneous leishmaniasis. So your cutaneous leishmaniasis, that's your Leishmania tropica. So this is the type of leishmaniasis where it try to infect only your skin. That's why it's being called here cutaneous leishmaniasis. Manifestation of the skin infection here is in the form of, okay, it try to cause here, okay, ulceration of the skin. We try to have an ugly scar, and it would appears to have like para siyang lepromatous leprosy. Diba? We have discussed in your bacteriology, there are two forms of the leprosy. One is your tuberculoid, the other one is your lepromatous leprosy. Sinabing lepromatous leprosy is more of the non-healing ulcer. So, para siyang skin ulcer, pero most likely do not heal. But for those patients na nagkakaroon ng healing process, nagkakaroon siya ng ugly scar formation. Then we have here the mucocutaneous leishmaniasis. Again, the mucocutaneous leishmaniasis caused here by your Leishmania brasiliensis. So this is characterized here by infection, primarily starting on the skin, but it tried to infect deeper tissue, mucous membrane. Most likely it affects your nasopharyngeal area. Pag sabing nasopharyngeal area includes your nose, your pharynx, your oropharynx, and it's characterized here by destruction of the tissues here in the septum of the nose of the patient. And the patient would appear to have a tapir nose or camel nose because parang, again, parang it's trying to destroy this area, so parang nawawalan ka na. Nabubulok ang nose. And another manifestation, we have your visceral leishmaniasis. Again, the visceral leishmaniasis is basically caused here by your Leishmania donovani. So, visceral leishmaniasis characterized here by the infections. So, start siya sa skin natin, pupunta sa lymph nodes. In the lymph nodes, pupunta sa bloodstream, ang parasite. After pumunta sa bloodstream, it try to infect the visceral organ in our body, especially those mga abdominal tract na internal organs natin. So visceral organs or hollow organs here are primarily that may be in the form of your mga intestinal internal organs. So manifestation of that, the patient will have the splenomegaly, hepatomegaly, and we have also the lymphadenopathy, characterized also by the fever, weight loss, okay, loss of appetite, diarrhea, cough, anemia, wasting, skin darkening, and many others. Again, this is caused here by your Leishmania donovani, your visceral leishmaniasis. So I'll be discussing each of that. Okay, so we start here discussion with the species Leishmania brasiliensis. Leishmania brasiliensis, again, this is your mucocutaneous leishmaniasis. Again, it's being transmitted by, again, the phlebotomus or the Leucemia species. So we have here the vectors, we have the phlebotomus verrucanum, parvensis, and we have your intermedius. Phlebotomus parvensis, phlebotomus intermedius. Okay, so other name, we have your Leishmania tropica variety americana, and we have your Leishmania peroxiana. Okay, for the disease manifestation of your Leishmania brasiliensis, we have here your spongia. The spongia here is characterized by the damage in the septum, the bridge of the nose of the patient, and that's characterized here by parang flesh eating. It try to eat this area, so the patient will have the manifestation of the tapir nose or the camel nose. Then we have here the uta. It resembles the oriental sore. Oriental sore is a type of cutaneous leishmaniasis. So parang siyang ating Leishmania tropica. Only that, again, is very prevalent in the Peruvian Andes. Then we have your chiclulo ulcer, again, very common among those patients who try to gather chicle gum or chewing gum among forest workers. And that one is, again, characterized by the erosion of the pinna of the ears. Okay, we have here the laboratory diagnosis for your Leishmania brasiliensis. So you have so identification of parasite is by your skin biopsy, because again, that's the parasite is in your skin, the mucous membrane. So you just need to have skin scrapings or biopsy of that for identification of the parasite. Then you could have your Montenegro skin test, will give a positive test here because this one is a skin test. So this parasite is still present in the skin. So in the Montenegro skin test, we are using here a wash attenuated na promasticot. So positive result here would be the presence of the redness or the bill formation. So I mean to say patient positive for that. So culture media, so we have that NNN, and we have also the Toby's diphasic medium. But this culture media is also applicable pa din in your Leishmania tropica and even your Leishmania donovani. Okay, the next one we have here the Leishmania donovani. It is also called your visceral leishmaniasis. So we have the vector, we have your phlebotomus orientalis, martini, and we have also here your argentipis. So for the disease manifestation, so let's try to consider your Kala-Azar or your black disease or your black sickness, characterized here by hyperpigmentation or nangingitim ang mga patient na mga light skin patient. Another one, we have here the dumdum fever. So we have here the different types of your Kala-Azar. So we have the classic one, it's very common among adult patient. We have also the Mediterranean in the young age population. And we have also the Sudanese Kala-Azar, so adult patient, but that one is more resistant to antimony treatment. Okay, for diagnosis of your Leishmania donovani, which is a visceral, so we are not using the skin biopsy for that because the parasite is not in the skin. So why you need to aspirate the other part of your body here, including the visceral organs, plus your lymph node, your bone marrow, or even your liver biopsy. So that's the most ideal na sample for the identification of the parasite or recovery of the parasite. For the skin test, Montenegro skin test, so this one will give a negative result here because again, Montenegro skin test, since the parasite is not on the skin, so expect you to have a negative result for the skin test. For the next one, we have here your Leishmania mexicana. So Leishmania mexicana, I will not be discussing much of that because your Leishmania mexicana is a type of your Leishmania brasiliense. It's also the mucocutaneous leishmaniasis. Kaya doon siya sa ating brasiliense pa rin na discussion. Lastly, for the Leishmania, we have the Leishmania tropica. This is your cutaneous leishmaniasis. So this is transmitted by the bite of your phlebotomus sergenti, and we have your phlebotomus papatasi. So for the diseases, try to consider oriental sore. We have also Aleppo boil, jerk ulcer, Baghdad ulcer, and Delhi ulcer. For the diagnosis, still we have the skin scrapings. So since the parasite in the skin, so try to collect on the side or the margin of your ulcer, and then try to examine under the microscope for the presence of your mastigot. And then we have also here the Montenegro skin test. Again, this one will give a positive result because again, this is a skin ulceration, so the parasite in the skin.